Bipolar disorder. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania, or hypomania, and lows, depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, less extreme than mania, you may feel euphoric, full of energy, or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medications and psychological counseling. Psychotherapy. Symptoms: Bipolar 1 disorder. Bipolar 2 disorder. Cyclotimic disorder. Other types. Although bipolar disorder can occur at any age, typically it's diagnosed in the teenage years or early 20s. Symptoms can vary from person to person, and symptoms may vary over time. Mania and hypomania, both the manic and the hypomanic episode, include 3 or more of these symptoms: abnormally upbeat, jumpy or wired, increased activity, energy or agitation, exaggerated sense of well-being and self-confidence, euphoria, decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, poor decision-making, for example, going on buying sprees, taking sexual risks, or making foolish investments. Major depressive episode. An episode includes 5 or more of these symptoms: depressed mood, such as feeling sad, empty, hopeless, or tearful. In children and teens, depressed mood can appear as irritability, marked loss of interest, or feeling no pleasure in all, or almost all, activities. Significant weight loss. When not dieting, weight gain, or decrease or increase in appetite. In children, failure to gain weight as expected can be a sign of depression. Either insomnia, or sleeping too much, either restlessness, or slowed behavior, fatigue, or loss of energy, feelings of worthlessness, or excessive, or inappropriate guilt, decreased ability to think or concentrate, or indecisiveness, thinking about, planning, or attempting suicide. Other features of bipolar disorder. Signs and symptoms of bipolar I and bipolar II disorders L may include other features, such as anxious distress, melancholy, psychosis, or others. The timing of symptoms may include diagnostic labels, such as mixed or rapid cycling. In addition, bipolar symptoms may occur during pregnancy or change with the seasons. Symptoms in children and teens. Symptoms of bipolar disorder can be difficult to identify in children and teens. It's often hard to tell whether these are normal ups and downs, the results of stress or trauma, or signs of a mental health problem other than bipolar disorder. Children and teens may have distinct major depressive, or manic, or hypomanic episodes, but the pattern can vary from that of adults with bipolar disorder, and moods can rapidly shift during episodes. Some children may have periods without mood symptoms between episodes. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swings. Causes: biological differences, genetics, risk factors. Having a first-degree relative, such as a parent or sibling, with bipolar disorder. Periods of high stress, such as the death of a loved one, or other traumatic event. Drug or alcohol abuse. Complications. Problems related to drug and alcohol use. Suicide. or suicide attempts, legal or financial problems, damaged relationships, poor work or school performance, co-occurring conditions, anxiety disorders, eating disorders, attention deficit/hyperactivity disorder, ADHD, alcohol or drug problems, physical health problems, such as heart disease, thyroid problems, headaches or obesity. Prevention. Pay attention to warning signs. Avoid drugs and alcohol. Take your medications exactly as directed.